So, hello everyone, welcome. My name is Kaustub. I'm an IMT1 in Kent and part of the specialty careers team at Mind the Bleep. So today we have got Dr. Joanne Comia with us. She's a GP registrar. So she's going to talk to us about applying to GP training and a day in a life as a GP registrar. Just if you have any questions, just pop them in the chat and we can go through them towards the end. So over to you, Joanne.
Okay, thank you. Good evening, everyone. Let me just put up my... So again, I'm Joanne Comia. I'm a second-year trainee here in Royal Cornwall Hospital. Before I start, I'd just like to ask, do we have enough already for me to ask this question? Just wondering.
Yeah, we can post as a poll.
Yes, I'd just like to have an idea, or at least a ballpark. How many of you are considering general practice as a career? We'll see if there's enough to respond.
Yeah, just give it about a minute or so.
Oh, there's 12.
So we've got about 20 responses, and 65% say that they're definitely considering GP as a career, and 35% are still deciding.
Maybe. Okay. Oh, wow. There's more responses coming in. Looks like there's a majority of you wanting to really go for GP, and I'm hoping you will still be considering going to GP after. Is that a good amount of number that we've gotten already?
Yeah, I think so. Yeah.
Yeah, no, that's good. All right. So it's good to know that a majority of you are considering to get into general practice. So our objectives for today would be to understand the process of the GP training pathway, examine the opportunities and challenges within the field, explore the key roles and responsibilities of the general practitioner, and discuss future career prospects in general practice. So, question, why become a GP? So, being a general practitioner, you do get a diverse clinical experience. Again, because you get anything under the sun when someone comes into the clinic. Depending on how much you take in, you can achieve a work-life balance and flexibility. But again, this is depending on how much workload you want to take. There's continuity of care, which is quite good in the GP setting. There is community-based work. There are leadership opportunities. Just a lot of this. There's also career developments. You'd be surprised. And last but not least, it's a shorter training pathway. However, this should not be the main reason why you want to become a GP. Just because it's shorter doesn't mean it's for everyone, unless you have other priorities, and that is one of the main reasons why you want to go to GP. So one of the qualifications necessary is either you have an MBBS or equivalent medical qualification, such as a Doctor of Medicine. And in order to be eligible for application, you have to have a full GMC registration and hold a current license to practice from the General Medical Council at intended start date. And you need to have an evidence of foundation competencies within the 3.5 years of training start date, demonstrated either through being currently employed in the foundation program, or you have already been awarded a certificate of completion of the foundation program from a UK-affiliated foundation program within 3.5 years of the training start date, or you're actually also currently employed in a GMC-approved specialty training program with either a national training number or Deanery reference number. So there are some doctors who are doing, maybe doing an IMT or another specialty, and all of a sudden they realize that they would like to they want to be a GP. Another way of demonstrating competencies would be you should have had 12 months medical experience after full GMC registration or equivalent post-licensing experience along with a certificate of readiness to enter specialty training form. This is mostly applicable to international medical graduates, but I will further expound on that. So I also do want to sort of run through a bit of the essential and other criteria that are necessary to get into GP. One that I want to highlight is that one should have a current valid driving license, or at least be able to commit to find other alternatives of transport when you're attending an emergency or a house visit, because this is part of the requirements of the training program. Some feel that you may not need to be licensed, but if you don't have, again, you need to find other ways of transport to go to house visits or to go whichever rotation you're in, because it's not just going to be in the GP. So this is the person specification. So, sorry, let me go back. You can find the other information through this website that I put here. But at the same time, I will also show you a very quick peek of what the criteria are. So I already mentioned the eligibilities, which means either showing employment in either of this, either as a foundation program or the 12 months experience, and the rest, fitness to practice, language skills. This can all be found in that website that I posted. And I just wanted to show to you all how it looks like. If you have any questions, I'll attend to it in the last part of the presentation. So regarding the certificate of readiness to enter specialty training, or otherwise CREST form, it's required for doctors who have not completed a UK foundation program, but they wish to enter specialty training in the UK. This form, it shows evidence of competencies in acute care, teamwork, communication, clinical decision-making. And the form can only be signed by a consultant or equivalent with whom you have worked with for a minimum of 3 months. Yes, we can post the link later on. We'll do that. Oh, there. Thank you. Thank you, Costa. And I will show how the form looks like. Just a quick peek. It's very long. So it's at least, it gives you guys an idea, or at least the international doctors watching, how it looks like, how it needs to be filled up. And the reason I'm showing this is because it's necessary with the application, or else you won't be able to apply. Sorry if I'm going too fast. So these are the consultants or doctors that would have to sign and prove that you provided evidence of the skills necessary. So you fill the CREST form for the international doctors. And for the other doctors here in the UK, when you want to apply, we go through the ORIEL. So I had to ask a friend to actually, if I could get a copy of her form. Reason is mine has already been deleted, but at least he kept hers. So as you can see, there are different phases in the application. You have apply. So when you apply, obviously, this is when you fill in the details of, what your current employment is, etc. It's a long application form. And then once you've submitted that, you need to also make sure that you have your CREST form. It's again for the international doctors. You have your CREST form already signed and prepared. As you can see, there's a CREST document tab that needs to be submitted in order for the application to go through. So when I applied for GP training, at my time, it was a bit more lenient. I applied in December. However, the deadline for the CREST form to be submitted was February. Now, because of competition, they now require that you have the form already prepared when you apply for GP training. So make sure that's already ready. So you've submitted everything. You now get longlisted. After being longlisted, you will then get, they will make sure that you have everything. If everything is okay, then you get shortlisted. Once you are shortlisted, that is when they will now request those to take the MSRA exam, which I will explain further after. So once you have been invited to take the MSRA exam, that will now go through the interview phase. So in GP, the only interview that takes place is the examination. I believe before COVID, this wasn't the case. There was an exam and there was also an interview, but now it's pure exam. And if you pass the exam, just because you pass the exam doesn't mean that you would, you need to have a certain rank. So if you pass the exam and have a good rank, you pass the interview and you eventually at some point will get the offer. So that's how it goes. I know it's a bit vague, but for anyone who does the oral form, you will eventually get to see how it, you'll get familiar with it. So the multi-specialty recruitment assessment exam, otherwise MSRA, it's a computer-based assessment. It tests you in essential competencies. It's also used for other specialties besides general practice, such as radiology, psychiatry, OBGYN, etc. It has two parts to it. One part is the clinical problem solving, and the other is the professional dilemma section, which many of you would probably know as the situational judgment test, SJT. And the good thing about it is free. However, it is only given twice a year. From the back of my mind, it is given in January and September. And I will answer, I'll get to that. And yeah. So now, what is it like being a GP? So general practitioners are the backbone of the UK's healthcare system. We are the ones that try to, we're the gatekeepers from getting people going into the hospital. We provide comprehensive medical care, diagnose illnesses, and manage patient treatment. And in order to become a GP, one requires a combination of academic study, training, and experience. Okay. So this is how the training program looks like. It's 3 years. It involves clinical posts in a range of specialties. And when you rotate around different specialties, it usually lasts 4 to 6 months. And these are usually relevant specialties to general practice, such as rheumatology, pediatrics, psychiatry, rheumatology, etc. The breakdown of training is it's 18 to 24 months spent in general practice post. The remaining months, again, like I said earlier, it's in hospital or integrated training post. If it's a bit confusing, I will get to it later. The final year of GP training is dedicated to general practice. So the training program involves developing your skills in diagnostic abilities, patient care, and management. You will always or often be guided by experienced GPs throughout training, usually your educational supervisor, clinical supervisor, and also your training program directors or PBDs. And portfolio is the main highlight. Actually, I just want to highlight that the portfolio, it documents the learning and progress towards completing the GP curriculum and capabilities for general practice. So for those who are in foundation program, I'm sure you have your, oh God, I forgot what it's called. Anyway, I know you also have your portfolios to keep up with. It's the same thing with GP, but it's a bit more detailed. We would require 36 reflections, and then this, oh, there we go, Horace. Yes, thank you. You have case-based discussions, mini-CACs, and all those things, and other requirements in the curriculum of the MRC, of the RCGP that is involved in the portfolio. So in order to become a member of the Royal College of General Practitioners, you need to successfully complete 3 components, which includes the workplace-based assessments, which you will prove through your portfolio, the written examination, which we call the Applied Knowledge Test, and lastly, the practical exam, which is called the Simulated Consultation Assessment. So it's, in other words, it's an OSCE. So if you're able to successfully complete all 3 of these components at the end of the 3-year training, you get certificate of completion of training. But not everyone finishes it in 3 years. There are those who take the LTFT path. They go less than full time. So I just want to give a sample of, this is my training timeline. Obviously, it's not yet 2026, but this is my plan. This is when I hope to finish my GP training. So from August 2023 to August 2024, my first year in training was all hospital rotations. I did rheumatology. That's not hospital, but it was clinic-based, but it was all about rheumatology conditions. I saw patients in the clinic. And then my second rotation was in community elder care. That was, it was a community hospital that served, it was like the AMU of the community. And then my last rotation for my first year was psychiatry. For my second year, which started this year, August, I'm in my integrated post. Integrated means it's a mixture of it's a mixture of hospital and clinic. So I'm doing 2 days of the week in hospice care and 2 days in GP. 1 day is reserved for teaching and personal development, or CPDs, the other CPDs that you would like to do. By next year, February 2025 to the end of August, to August 2025, I will be in pure general practice. So during my second year, within this, from August 2024 to August 2025, my aim, besides obviously completing my portfolio for this year, is to also get the AKT done. To pass the AKT by the second year, you can only take this exam when you're in second year, because you should have at least had already a feeling of what GP training is. It's my first year. I didn't have any GP rotations. And then by third year, August 2025 to August 2026, I will be in pure general practice. And during that period, I should also be looking into finishing my simulated consultation assessment, or SEA. So these 2 exams are necessary in order to complete the training. So, day in the life of a GP. The morning session, so as a trainee, I usually start I go at 8 o'clock. Even though my first patient will come in at 8:30. The reason is so that I can go through the list of the patients that I will be seeing. If I need to read a little bit more and study more about them, that 30-minute gives me time to at least prepare. When I start my clinic, as a trainee at the moment, I am given 30-minute consultations, but for others who are more experienced, they are given 10 to 15-minute consultations, which involves history taking, physical examination, diagnosis, and treatment plan. at 10 a.m. For most practices, I heard we have tea break. Tea break is really important. Others may not go for tea break all the time, but they do try. Main reason, it's really important that you do set aside time for your, again, mental well-being. And at the same time, you get to see other people, because being a GP is a very isolated work. You're always in the clinic. So being able to mingle with other GPs is actually a good thing. And you will also learn from them, because this is a time when we're sharing stories or asking for advice. Having a good laugh is also very important. Then 10:30, another round of consultation until noon, 12:30 p.m. So 12:30 p.m. for some for some, not everyone needs to do a home. Some will do home visits, so they put it in around lunchtime. And when you go for home visit, this is a time when you might actually need to bring a medicine bag, is what I call. It has all your things in it for being able to do physical examinations. And when you also do home visit, it's not just doing physical exams. You may have to review medication, assess the patient's home environment, and manage ongoing care for those who are unable to make it to the practice. Then you aim to at least have your lunch break by 1:30 p.m. So during lunch break, some also do their administration. It's one way to fit in the work that needs to be done. I also actually do my administrative stuff during lunch. So during this time period, you complete patient notes, respond to emails, sign repeat prescription, handle urgent matters that have arisen during the day. By 2:00, consultations will start. I think this is a little, 1:30 to 2. That might be too short for some. It might actually be a 1-hour break, but it's just showing the possible schedules that are out there. So 2:00, start the consultations. The same thing in the morning, 10, 15, or 30 minutes for me. And then by 4:00, you have MDT. It doesn't always happen in the afternoon. Sometimes it starts in the morning. They have it in the morning. And MDT usually would involve district nurses or anyone else involved in the practice that needs to be that is also part of the team. And it depends what goes on in the MDTs if they have to talk about certain patients. So by late afternoon and evening time, we finish usually by 5 p.m. And 5 to 6, we do more administrative duties. Again, it's more administration, going through discharge letters, looking through bloods, doing referrals, etc. So, what are other responsibilities and roles of GPs? So we have out of hours. So GPs sometimes do on-calls for emergencies during weekends or evenings. GPs are also, we teach and we train. There's a lot of, so in every practice, there's always going to be a trainer who's teaching registrars. And there's also clinical audits and practice management. There's always going to be QIAs and QIPs involved. So, what's the T? What are the things? So, yeah, I feel like GP is it's a highly rewarding profession, but it does come with several challenges. As you see the schedule that I've shown you, it's quite jam-packed. How can you see patients and at the same time be able to do administration? So one of the challenges is the workload. There's high workload and time pressure. GPs we often go beyond our schedule. And because of the high workload, we can eventually have burnout and stress, which is why, again, it's important you contemplate or decide on how many sessions you want to take on as a GP. So sessions is what we refer to how many, it's divided. You have the morning. So 2 sessions mean you're doing morning and afternoon part of the day. So others work for 3 days. If you want to burn out, you wait for 5 days. But I know a lot of people do 3 to 4 days only of GPs. They don't do the whole week. It's hard to find. Work-life balance can be achieved, but for some, like partners, GP partners, I think they're the ones who probably find it more challenging to find a work-life balance. There's also a lot of politics. There's a lot of loopholes that you need to go through when you want to do things for your patients. And I think that's just one of the challenges for most doctors, but it's the same thing for GP. But, there are also other things that we can do. So life after training. So either you stay in general practice. There are 3 types. You can be a GP partner. So GP partners are responsible for running the practice. And they're expected not only to do clinical sessions, but they are also expected to take part in the administrative and business side of the practice. And they do make more money, but then that will depend on the finances of the practice and how it's distributed. Salaried GPs are employed by the practice and they receive a salary for they receive a salary for a contract number of hours worked. This is what I was talking about, sessions and how many days that you want to work within a week. And then you have locum GPs who cover, it's the same thing in a hospital. Locum GPs are there to cover sicknesses, or cover those who are going on leave, or to just the backlogs of the practice as well. And then besides being a GP, you can go for special interest that involves dermatology, palliative care, sports medicine. Others go into academic medicine, which is mainly research. So I worked with GPs who actually do 2 days in the GP practice, and then the other 2 days they're doing research. They're in the university doing their part. Others become clinical leader, medical directors. Others go for public health, digital health. Others use general practice as another pathway to get into other training. So, for example, there is occupational medicine. One of the requirements of going into occupational medicine is general practice. Aviation medicine, if any of you have heard of it. And there's also rehab medicine. So, it still opens you to windows of other opportunities. And then, again, you can also go international. We could go to Canada, Australia, and New Zealand. Those are the famous ones to go to. So, any questions? I'm hoping that wasn't too fast. I think there are questions that are already here.
Yeah, so there are 2 questions we've got. So the first one is, do we know when we can start the application on Oriel?
I usually keep tabs of it like a month before August. So there's two application or recruitment happens twice a year. So for the how would I explain this?
I think was there not three applications? One is the normal December one is the February and September.
The September one is the one with the August one. Like, so August you apply, you take the exam in September. The main recruitment happens in December. So around October, November, I think around that time, the applications open, and that's when you can fill in your Oriel form. And the application will close by the mid part of December. And then after that, they will start accepting people for the when to take the MSRA towards the end. And then January is when they do the exam. And then for the next intake, which is in the middle of the year, which is less number of slots, maybe 400 versus the one in January, which is 4,500. So for the second one, that happens around September, the exam September. So around July, the applications open. So that's when you can start filling up the Oriel form.
Right. Okay. Fine. So the next question that we have got is from Alice. I've heard that the first sitting of the MSRA is the only one that counts now if you have passed. Is this true?
At the moment, yes. I have been hearing this. I have friends who've not been able to take the MSRA for what is it? So they already had the intake in September for the February start of the year. I think people might become more confused now. So those who are taking the exam in January are starting August, and those who are taking the exam on September starts on February. I hope that clarifies things. So the ones that took the exam this September for the February 2025 intake, I've had friends who've not been able to sit the MSRA because mainly they've taken the exam and they're giving priority to those who haven't. Because of the competition. That's just how competitive it's gotten. I don't know if this will be the same by next year. I think there's that question mark that's still lingering, and I won't be able to really answer if that will be the same for next year. It could possibly be a clean slate because that's when but oh my god, hope sorry. It's this year. All right, erase. By this year, August, around December, they will start having another intake for the August 2026 batch. So
25. That's okay.
Sorry, 2025 batch. I'm sorry, 2025 batch. So I'm not so sure if they're going to have a clean slate, but it's possible because there's going to be more slots available for the August 2025 batch. There's going to be about 4,500. It's possible that people can retake the exam for a better score.
Yeah, so I just wanted to jump in because I've heard similar things, and good that Alice brought this up. So I think possibly, again, everybody is assuming that this is the case. So if you have given the exam once in the recruitment year, so main recruitment year being you apply in October, November, and take the MSRA, I think, in January the next year.
Yes.
So that's the main recruitment year. And then if you have applied once in that recruitment year, you have to use the same score. But people are saying that if you go to the next main round, the next year, then you can again take the exam, but it's not clear yet. So yeah, that's definitely happening.
It's still very vague. And only now this has happened because I'll be honest, I took the MSRA about 3 times, but mainly because I wanted to keep on trying, and because the chances really with the one with the it is challenging to study and balance work at the same time. When I was studying for MSRA, I was working in South End as a clinical fellow in endocrine and infection, so it was challenging, but it's not impossible. But obviously, now I would really suggest if you want to really get into a slot, study the best that you can because now it's really competitive and new rules are coming out.
Yeah.
So
and also just one point that I wanted to add. Previously, people used to take MSRA multiple times because it was free and it used to be like a practice. So you just go attend the exam and then do it again. But I think that's not an option. They have realized that people do that. So you have to do it once and do it right. At least for GP, that is the case.
It is true though. Like when I was taking the exam, people would just tell me, keep on taking it. It's good practice, and it's for free. And the more you do it, the more you get better at it. But that's not becoming now. It's not becoming an option now available for many.
Yeah.
Right. And then someone actually explain more what it means. Oh, is that good? You think that we've covered that part well enough? Do we have anything else?
I think so. Yeah.
Could you explain?
The next question is, could you explain more what it means to be a GP partner?
So again, GP partner means you take on more responsibilities as compared to those salaried GPs, mainly because you do the business side of the GP practice. You either take part of the finances, you do the administrative part. It's hard to say really because I've only seen them what they do, but they do take more responsibilities. Even so, whatever the salary GPs are doing, they also have to overlook and see if they're doing everything all right. It just means it's just like owning part of a company, but not in this case. It just means that you're just taking in more things to do. But it's like, well, I think that's how it is. It's like you're owning part of the company because you're seeing how it's running. And if it's running all right, if it's doing things, meeting the requirements that the NHS and the whatever policies that you have to follow.
Is it profitable? I think that's what
the thing. Is everything you're doing profitable? Are you being paid for what you're doing? So you need to make sure that you got money coming in and not just only going out. So
you get paid extra if you're a GP partner, or you make more money.
You do get paid extra. So I do have a range here. It could be up to £101,500 versus being a salary. Yeah, being a salary GP would be £56,000 to £85,000. So there is a bit difference. How does one become a GP partner? Ooh, I'll be honest, I'm not really so sure about that.
Okay. I'll go to the next one then. Do you know which English?
I'm not really looking at becoming. Well, the reason I'm not looking to it because it's not in any of my interests at the moment. It looks like it's a lot of work. I'm not discouraging anyone from becoming a partner one day.
The next one is, do you know which English-speaking countries recognize UK GP training?
Oh, yeah. Again, like Australia, New Zealand, and Canada. So with Canada, you still have to take an exam depending on the provinces that you're going to go to. Australia and New Zealand also does recognize UK GP training. I'm just not so sure on how the process is. I think in New Zealand, you may have to have 1 year where you're being supervised, and I'm not so sure if it's the same in Australia. But it is transferable. So I know a lot of GPs have gone. Well, I don't know. I've heard a lot of GPs have gone there.
Okay. The next one is: has there not been a reason about the exam being just? I think we covered that. Next one is: for special interest, can it be other specialties too, like rheumatology? I've seen dermatology, but was wondering about others.
Rheumatology, yes. My clinical supervisor in rheumatology was actually a GP. And then he just focused on, I think he just did further training, and he also became a consultant in rheumatology. So yeah, it's possible.
Do you do specialist, like pure rheumatology clinics as a specialized GP with special interest?
I think he did further more training because it's not just special. And he just focused on rheumatology. He didn't do any more GP. But if you want to do, the thing is, when you have special interest, it doesn't mean that this is the only thing that you'll be doing. So for other GPs with special interest, they may do 2 days, 3 days as GP, and then 1 day will be doing what their special interest is.
Okay, fine.
Does it make sense? Yeah.
The next one is, why did you personally choose to be a GP?
I guess priorities in life. I wanted to be able to find a job that I know I can find work-life balance, that I can see a variety of people, and that could give me other opportunities to do other things. And for example, if I want to go for other specialties, GP is really a good foundation because you learn so much from A to Z, from babies to adults to elders. So I think it's just a very good. It just gives you very good foundation, and yeah.
Right.
I think it's a flexible profession. It's really up to you and how you're going to just manage your career.
You did mention things like public health, aviation medicine, and
yes,
I think digital health.
Actually, I will be truthful. I am very much interested in aviation medicine, and GP is one of the routes to it. So I know aviation doctors who are GPs. They will do 1 day, 2 days in the general practice, and the other days they are doing aviation medicine. So that's the best part. I know someone, no, I don't know him personally. So I attended a digital health conference. One of the speakers works for Microsoft. He does 1 day of general practice and 4 days he's with Microsoft. So that's the good thing about GP, general practice. You can do so many, even just besides by being a GP.
Interesting. Yeah, lots of different opportunities there. The next one is, I believe there's a cutoff score. If you score below that, then you will be allowed to retake the MSRA.
This was the case before, but now, if there is a cutoff score, if obviously you've failed, in other words, you get a band 1, band 2. Sorry. So there are different levels of scoring. If obviously you've not met the cutoff score, then yes, you're allowed to retake the MSRA. That's correct.
Right. Okay. How do you score highly on the MSRA?
Oh, dedication.
I think I can rephrase it. What resources did you use? I think that's something that
for me it was Fast Medicine.
Okay.
Fast Medicine for me was really helpful, especially the knowledge tutor. Others did take online courses, but I'm not going to be, how would you say this? There are options, but I'm not going to be recommending them to you as something that I would say must be having. So you have eMedica, Aurora. I think those are the ones that are very common. But
just to clarify, these are the online courses.
These are online courses. That's another option that you can do if you want to score highly in MSRA. Again, because it's an SJT and plus clinical. Clinical is, I think, something that you can do very well by just doing questions. But the SJT, the clinical, the SJT part, or the dilemma part, I still call it SJT. I think that's also good. That's practice. And if you have already had experience in a hospital, that is a plus. You can apply it to it. You've taken the MSRA, right, Costa?
Yeah, I actually did apply for the MSRA as well. I did apply to GP training, and I also applied to IMT, and then I chose IMT. I mean, it's yeah, I did use Fast Medicine as well. Yeah. Okay,
so yeah, no, it really varies. For me, it was Fast Medicine.
No, I think we got. So then the next one is it true that getting a job as GP is harder now, especially due to the growth of PAs?
I don't know if it's because of PAs. PAs will not be able to do what GPs are doing, I just realized. I think it's just depending on where you're applying for a GP, where you will be applying as a GP. When you're a GP, there are some areas that are already very saturated. I think the challenge is depending where you're applying. So if you go to London, it is going to be a bit more challenging to find a job versus maybe Scotland or here in Cornwall or in Wales, maybe. But yeah, no, the reality, it's not just it's not only just GP, it's just everywhere here in the UK. It's becoming more challenging to get a job, I believe.
You mentioned about probably moving into another specialty. How does that work if one wants to move to internal medicine? I don't know what that means. Can you please clarify, and we can come back to that. Any resources to learn for the MSRA other than the question banks?
Again, eMedica, Aurora. I think those are the main two ones that I really know. I don't know of any other question banks.
I think from the colleagues that I talked to, one of the things that I can recommend is there's this. There are MSRA papers, I think, that are available somewhere on the website. So there are like four or two papers, and there's an Oxford SJT book which you use for your foundation application?
I've tried the Oxford SJT. I don't think it mirrors very much of the exam, the MSRA, because the SJT and MSRA I realize is more mirrored with GP.
Sure. You mean the MSRA is more GP based and the Oxford is more
GP-based.
F1 hospital based?
There are some situations that takes place in the GP, and that isn't really something that you would find often in the Oxford handbook. I've read it. I've gone through it. Sure. It's okay. But I think it's more applicable to the foundation doctors. But, yeah.
Oh, good point, yeah. How long would you say one should prepare for the MSRA?
I would say 6 months is a good one. 3 months is okay, but still cutting it short. If you're having to balance work and studies, 6 months should be. This is the practicality. 3 months can be possible, but that means you just need to really ramp it up more.
So I think basically start now, if you haven't started already.
Well, I'm just saying this now because I'm seeing how very competitive it's getting. So the more you prepare, the more the better. So it's just saying, obviously, you will not prepare for it 1 month before. That's just roadkill.
Sure.
I'm not really just, if in case that is your situation at the moment, doesn't mean that it's impossible. It's still possible because you learn. If you're working, you should be learning at the same time and be able to apply what you've learned in the MRSA exam or MSRA. Yeah.
The thing, we have one more. Can the GP have special interest in CAMS, child and adolescent mental health?
I believe so. Can I ask someone who I think is online that might be able to answer that question with mental health wise? I mean, I think so. Because I know GPs who are having special interest in mental health, so I don't see any reason why they can't do it with child and adolescents mental health. But I won't be able to give you a 100% answer of yes.
I think more of I personally think if you do psychiatry, then you also do you can also do community psychiatry and CAMS. I'm sorry, I'm not sure about that one. Never heard of anyone who is a GP and then done CAMS, but could be possible.
It could be possible, but it's quite a very highly specialized part already of the mental health part side. I've only met people who have mental health as a special interest, but not an adolescent. Unfortunately, I won't be able to give a 100% yes. Maybe, possibly.
Perfect. I think that was the last question. I'll give it about 30 seconds.
References.
So I've posted the link for the feedback. So if you all could please provide the feedback, that is how you get your certificates, and it also helps us to develop and organize future content for you. So again, thank you, Joanne, for talking to us today about applying to GP, and thank you everyone for attending. Just give it a minute or so if anybody has any questions. Otherwise, we'll call it today. It was an interesting talk and a good conversation about various opportunities after doing GP. Learned quite a lot.
Yeah, thank you for having me as well. All right.
While we wait for a minute, I was just wondering. It seemed like a very, very busy day when you showed your schedule from 8 to 6. So are you paid from 8 to 6 p.m. or do you voluntarily go a bit early?
You're obviously paid for the time that you're supposed to be in, but obviously others are spending. There are those who are spending a bit more overtime because they have the amount of work that you have to finish. But others do try their best to finish it on the dot.
Sure.
Thank you. They
And
try.
can you exception report in GP training, or that's something that we do in IMT sometimes?
I think it's more easier to do that in the hospital,
Right. Okay.
being in the GP setting. I've not really seen anyone really do exception. No one's told me about it. I've done exception reporting when I'm in the ward,
Yeah.
but I've
Yeah.
not done so
Certainly.
far. I've not really have to stay too well. No, I'd stayed a bit late, but not that late. But the thing is, my colleagues are also there until 6 o'clock, so not just really me. But you know what? Maybe I should give that a try and ask if that's possible.
Yeah. Yeah. Just a thought. I mean, I've recently stayed late, so I was wondering. So I've just posted the link to the feedback form again if the previous one does not work. But yeah, otherwise, thank you everyone again. Thanks for taking the time today, and stay tuned. We'll have more specialty webinars if you're interested. So the next one is going to be on 8th of October. It's going to be on IMT. So if you are interested, we will see you there.
All right.
All right.
Okay, bye.
Thank you very much.